All right, it's 2024, and I thought it would be a really good idea to talk about certain things you should be having around your home. So, in case inflation keeps getting out of control or it gets harder to find certain products, I know we had a big issue with getting certain medications last year, and now that things are really ramping up in the Middle East and militarily, I think it's a good idea just to not stress out if you're prepared with certain things around the home. So I thought I would go over some first aid items you should be stocked up with, and that way you don't have to worry if the store runs out. So the basics that I like to have for sure. I just thought I would show you this. This is my little med kit. This little box, it's empty because I'm going to show you why. This little box fits this little pill box. Now, these are just my as in case on the go kind of first aid kit because I'll travel with it. I'll bring it with me. So here's what I have in this little kit. So the first thing we have right here is Benadryl, right? No explanation needed, right? Diphenhydramine, Benadryl. There is a medical article coming out of Florida State University that they studied stopping the COVID virus replication in its tracks using diphenhydramine, which is Benadryl, and lactoferrin, which is found in milk. And I thought that was really good to know that. But I also like Benadryl for seasonal allergies, or for some people, bee stings can be so dangerous, or whatever. Benadryl is always good to have on hand, right? It also, we use it in the hospital as a sleep aid. When people can't sleep, we'll give them Benadryl or Vistaril. We inject that. So Benadryl, first one. Be stocked up on that. Of course, my next one is Advil. It's ibuprofen. I know it's not natural, but when I have, back pain and turmeric isn't working, or the natural things that I usually use aren't working, I will take Advil and it will get me through the day. Also, when I was really sick with COVID and had really bad headaches, I was taking Advil because nothing else was working. So there's that. Okay, the next one. Now, I'm going to get into some prescription things too, which if you and your primary care doctor have a great relationship, they can set you up so you have your first aid kit ready to go. I see patients. I am in Arizona, so if you're in Arizona, I see family practice patients. But so my next thing is Augmentin. So Augmentin is in the penicillin family of medications. So if you're allergic to penicillin, you can't take Augmentin. But why I like Augmentin is because it treats many upper respiratory illnesses, certain types of bronchitis and pneumonia, and sinus infections, and more. So it's so safe that children can take it, adults can take it. So I like having Augmentin because, it just kind of treats so many things. So I like that antibiotic. Now, it is an antibiotic. Lots of people are allergic to penicillin. I'm just throwing that out there. Okay, then the next thing I have is Aleve. Aleve is another over-the-counter pain medication. I keep it because I find a lot of people that have headaches or migraines. I don't take really this one myself, but I find I have to dispense it out. Other people I work with, if they have a headache or a migraine, they like Aleve. So I kind of keep that with me to help other people, not necessarily for me. The next one I have right here is Flexeril. So Flexeril is a prescription muscle relaxant. I got that from my doctor that I see because, again, my back pain can sometimes seize up all my muscles, be so debilitating that I cannot get out of bed and function. Flexeril will at least allow me to function. And I don't use a lot of it. I think I took one pill last year, but it's in my personal first aid. So it's what I need. And that way you can decide your own little mini pharmacy of the things that you can't be without. My next one, of course, is baby aspirin. I think baby aspirin is so important. I don't really have any cardiovascular risks or history. I'm not overweight. So I take a baby aspirin about once a week. I only do once a week and not every day because baby aspirin can also lead to nasal polyps, bleeding gums, bruising, and I don't need that. So I take it once a week just I don't know, more for prevention so I don't have a stroke or a heart attack, or if I do, I have a little aspirin in my system. I may move it up in the next few years and take it 2 or 3 times a week, but right now I just kind of take it once a week if I can remember. My husband, though, he takes aspirin every day. And a lot of people that you may know, family members with high blood pressure, or they have had already a cardiac event, or they have high cholesterol, whatever, they're probably on a baby aspirin a day. So that's 81 milligrams. It's a chewable. So I like that. People that have stomach upset are usually on the enteric coated kind. Okay, the next one in my little box is Cipro. So Cipro, people call it an antibiotic, but it really falls more under like almost like a chemotherapeutic agent, because, and it does come with a black box warning. It traditionally is used for treating very resistant pneumonias and bladder infections, kidney infections. Some people can be very allergic to Cipro and have a bad reaction. There's a black box warning of tendon rupture. So people have ruptured their Achilles tendon, the tendon right behind the heel in the calf. So you have to be really careful with Cipro. I don't think I've ever taken Cipro. I like to have it because the shelf life on Cipro, if you keep it in a cool, dry place, is something like 20 to 30 years. So if all else fails, for resistant pneumonia that can be life-threatening, at least I have Cipro on hand. And I don't think I'll ever have to buy it again because the shelf life is so ridiculously long. And then my last thing in here is my emergency prescription pain medication. The interesting thing about certain pain medications, I've read online that, for example, Percocet that has, oxycodone and Tylenol in it, if kept in a clean, dry place, the shelf life on that can be 10 to 20 years, which is amazing. Now, I'm not saying to keep your pain medicine for 10 to 20 years. I'm just saying that is the research and what I've read on the internet. I don't advise my patients to keep it 10 to 20 years. So, follow the label on your medication bottles. If it says it expires in a year, just follow that label. But some of the research I've done through the government websites, because they have to store certain medications, they stockpile medications in case of a countrywide emergency. And that's where I've been getting some of this information. So take it with a grain of salt. But anyway, I keep that as my emergency thing because sometimes people have emergencies and they need something strong. I don't think I've taken this in the last couple of years, but it's good to have an emergency stock. Okay, so that's what I keep in I'll call it my front shelf medication emergency kit. I am very fortunate to not be on any prescription medication, so I don't have to worry about, having thyroid medicine or high blood pressure medicine or insulin right now. For a while there, I was taking metformin, but since I've had a lot of weight loss, and I talk about that in my videos from last summer of how I got down to my lowest weight I've been in years, I don't need to take my metformin anymore. Like, my blood sugar is really good right now. So that's good news. And if you're wanting to get off medication, losing weight is a great way to do it. I'll just say that. However, here's my next do or die. You must have this in your emergency kit. Lugol's iodine. So this is the one I have. This one is the 2%. Okay, this is so great because this will never go bad. Now, there's not even an expiration date on this bottle. And because pretty much nothing, put a little asterisk by that, nothing can survive in there, but pretty much because with 2% Lugol's iodine, bacteria, fungi, virus cannot survive in here. So again, keep it in a protected, cool, dry place away from sunlight because it's in a dark bottle. I just keep it in the cabinet and keep it away from children, of course, because if you drink this, it can shut down your thyroid. So Lugol's iodine has so many uses. I like to use it topically for cuts, abscesses, infected cysts or boils. I've had people with cellulitis before and they have multiple antibiotic allergies and they can't take antibiotics. And that's where my topical Lugol's iodine comes into place because It's a great anti-infective, and the shelf life on it is amazing. So I think it is a really great thing to have in your first aid kit. And I like it that you have to kind of buy it once and kind of forget about it because it just lasts forever. It is made of potassium iodide, 4%, and iodine, 2%, and distilled water. Now, there are other medical uses for Lugol's iodine. I'm not going to tell you exactly how to do it. That's not what this video is about. But it has been known to treat certain types of pneumonia, bladder infections, and iodine deficiencies. Yeah. So, but I'm not going to explain how to do that here. That is beyond the scope of this video. But that's why I think it's so important to have Lugol's iodine. Okay? Okay, now this one I'll call, it's not really, this one should not go in a first aid bag, but again, most of my audience are women over 45, 50, and it's so important to get your B12, right? Because you want to have strong muscles and bones, and B12 is so important for avoiding the complications of osteoporosis. So I have my little sublingual B12. Just put it under the tongue. This one is kind of nice because it's a probiotic fermented B12. And it's the methylcobalamin type, not the hydroxycobalamin. So if you're in the store, the methylcobalamin, and I'm not going to go into why right now, but it's the better form to buy. So buy the methylated. Okay, so it also helps with optimal brain, nerve, and cellular function, which I could always use. So that's just kind of like in my little daily thing that I like to do. Okay, and then I always think it's a good idea. I just keep this little bag in my purse, and that's where I kind of put this box. So then I have this because it wouldn't fit in my little box, but here's what's in my little mini Ziploc baggie. I have some Imodium in there. And I like to keep that especially with traveling because say you have to get on a flight or you have to get on that train, you know, and if God forbid you got some kind of ailment and you just had to keep going to the bathroom with diarrhea or whatever, Imodium is not killing an infection. It's not treating a gastrointestinal infection. It's not. And in fact, I think it could make it worse. But say whatever it was, something you ate upset your stomach, or you have a little virus going on and you have to get on that flight. I myself would take an Imodium. People that experience irritable bowel and whatnot, and they're like, oh great, now it's flaring up and I've got to get on a flight. Imodium will shut that down so you can get on that flight, get home where you're safe, stop taking that, and then get the medications that you need or the treatment that you need. So again, it's kind of in my travel bag. It's like an in-case kind of first aid thing, which I think is helpful. And then, okay, so that's all that's in that baggie, I think. And then I also have, well, I think I used all that was in there. Maybe I used all of them. Well, in this same little Ziploc baggie, I have the tablets, the chewable Pepto-Bismol. Again, same thing, extreme stomach upset if you suffer from, you know, GERD or reflux, or again, you kind of have some stomach upset and you have to get on a plane or a train or a boat or whatever, little bit of Pepto-Bismol. I know for a lot of my patients and myself, Pepto-Bismol can really settle an upset stomach. So you have to be careful though. It's not really meant for young children. Children under 12 probably shouldn't be taking regular Pepto-Bismol because of the bismuth salicylate that's in it. But for adults that take it, just remember the side effect is it can cause black tongue and your stools or your poop may turn black. It's okay. It's a side effect of Pepto. You don't have cancer. Okay? But I like to carry Pepto-Bismol tablets either. Now, at home, I prefer the liquid. I keep it in the fridge, but you can't really travel or have it in your bag as easy, so I'll do the chewable tablets instead. And then in my just kind of go-to purse-size first aid bag, I like to have, you know, a chapstick because, right, when your lips are dry and chapped, isn't that the worst thing? And I like to have an extra in case someone needs one. And then it's always a good idea to have in your kind of secondary bag, which is a much bigger bag that I have that I don't put in my purse. And I'll have simple things in there, you know, like Tums, you know, Tylenol for people that can't do ibuprofen products. It's good to have some Tylenol. I'll do, you know, Mylanta, maybe Maalox, sometimes milk of magnesia, you know, your little over the counter little shelf pharmacy. So maybe I'll do that one on a separate video. I have a very old video where I kind of go through my bin, but I like to update it. Are there other prescriptions? Yeah, I mean, because I had Augmentin in here, you know, not only for treating myself, but my whole family, you know, with children, you know, mostly they can do Augmentin, but sometimes pediatricians will just do plain amoxicillin, and then they dose it by kilogram. So, you know, that's something to consider. You know, and it got me thinking about it because have you watched that Netflix movie? Oh gosh, what is the name of that? Oh, we just watched it. No, Leave the World Behind. Julia Roberts and who else is in it? Ethan Hawke. It's really weird, but so anyway, you know, the internet goes down or there's some kind of hacking. The power goes down. Long story short, the son gets bit by a tick, and I can't remember in the movie if they said it's Lyme's disease, but they made it sound like he had Lyme's, and then they had emergency go get medication, which, again, yes, you want to be treated as soon as possible for Lyme disease. Usually it's doxycycline. The thing, though, is you can't store doxycycline. Once it reaches the expiration date on the label, it can be toxic and it can kill you. So don't stockpile doxycycline. That's my advice to you there. But doxycycline is one of the antibiotics that treats Lyme's disease. And the thing with Lyme, if you're bit by a tick, you get the bullseye rash. It looks like a target, but not all people get the bullseye rash. And not all people are bit by a deer tick. Deer ticks are what spreads Lyme's disease. And yes, it's very prevalent back east in the forest because they hang out in the leaves where the deers go back and forth. And then they just wait for someone to walk by, cling onto their clothes, and then they crawl, and then they bite you. So I always say, you know, if you're hiking, tuck in your pants to your socks, tuck in, you know, wear long sleeve shirts. And then before you go in the house, have someone else check you head to toe or check yourself head to toe, shake your clothes out. And I probably would do this extra. I would probably take everything off in my mudroom or the garage, throw it in the wash, check all my skin for any bites, shake your hair out. Probably best to wear a hat if you're walking. I mean, that's how bad we're talking about. Lyme disease has hit every state in the country now. But, you know, I live in the Southwest, and we see other types of tick-borne diseases like Rocky Mountain spotted fever. That's the big one on this side of the world, or the country. So, you know, it was weird, too, because in that movie, it was like the underlying theme was Lyme disease. Like the shirt Ethan Hawke was wearing in that movie, it said Bikini Kill. And I asked my husband, I'm like, do you know what that shirt means? And he said, no. I said, that's a punk band from the early 90s. And the lead singer has Lyme disease. And so she's an advocate of, you know, making people aware of Lyme disease. And I was like, that's weird. Plus all the deer being around because the deer tick carries Lyme. And then the son getting so sick. Like, what was that movie trying to tell us? That, like, look out for Lyme disease? Or is Lyme disease a bioweapon by the military? Like, I don't know what they were trying to tell us. But the moral of the story is the family in that movie had to go find antibiotics. They had to pay this ranch farmer $1,000 for his antibiotic. And I'm like, okay, why go through that if the power goes out or the internet goes down or the phone goes down and you have an emergency? It's better just to be prepared. And, you know, the nice thing about being prepared with medications, you're probably going to use them. I mean, and if you don't, okay, throw them away when they expire, right? I know my listeners, people that watch this channel, they already know all this stuff. So, okay, I could just go on and on, so I better stop here. Please comment below if you, you know, have a tip of your own, and then I'll do a part 2 of other stuff I like to stock in my house and in my office. Okay, guys, I'll see you on the next one. Click out of here.